I'd like to welcome Harpreet Sarna, who is our Chief Medical Officer from Vitality. And I think you know the drill now, so please don't hesitate to put your questions as soon as possible onto Slido as we go through first sort of 20 minutes with Harpreet, and then that will give us some time to start to respond to some of those questions in the last sort of 5 minutes. Okay, so thank you very much.
Great. Thank you, Richard. Thank you for the warm introduction. Let's begin. In 2023, UK employers lost £138 billion due to employee ill health. And that's it's almost too big of a number to imagine. If we put that into context, this was about 80% of the total budget for the NHS in 2023. But here's the thing, a lot of that money that was lost is preventable. For almost 10 years, we have been spending a lot of our time looking to understand what is driving ill health in the workplace. And it changes as the years go by, but the answers are becoming increasingly clear. But collectively, sometimes we don't always spend most of our time in those areas. I'm Harpreet Sarna, Chief Medical Officer at Vitality, and I'm a doctor by training. And it's great to spend the next 10 to 15 minutes just talking through some of the challenges that we see and some of the opportunities that also exist. And hopefully I can give you some proof points around what we can do differently if you have the right sort of proactive approach and proactive partner. Vitality Health is a major health and life insurer in the UK. We have around 1.9 million lives on our books. And we have a core purpose, which is to make our members healthier and to enhance and protect their lives. For over 30 years globally, through we call it our Vitality Programme, which is our behavioural science platform, we've been successfully improving the health of our employees. Of our members, I should say. Before I dive into taking you through sort of this journey, that was a moment of honesty. It's a really difficult time right now. Inflation is biting. It's more difficult sometimes to access care on the NHS. National insurance is just making everything more complex, and healthcare costs are going up. I suspect because we're all at REBA 2025, none of us are here to put our head in the sand and pretend it's not happening. Now is really very much the time sort of for bold thinking. And certainly from the conversations I've had out on the stand and also conversations I have with you outside of this conference, we're hearing that employees are increasingly looking less for a transactional brochure of benefits that they can tap into, but often looking to employers and to health insurers for something different, something a little bit more meaningful and smart, a system and a culture which helps them take the small steps they need to be healthier, which means they're happier, more productive at work, and you have a more resilient workforce. So I mentioned at the top that we've spent a number of years now looking into what health and well-being in the workplace means. We started this piece of work in 2014, we call it Britain's Healthiest Workplace. And we're answering some of the big questions around what's driving health and well-being. We've done this through a partnership with Cambridge University, Rand Europe and Financial Times. And it's given us this real kind of academic rigour to the research. And what we've got is this very rich longitudinal data set with insights from 600 employers and almost 200,000 employees. But what it isn't data for data's sake. It's a very robust data set. But what it's actually giving us is a window. It's giving us a window into our employees' health and into their habits. It's giving us insights into what's working, what's not working, and where the opportunities lie. Some of the research findings are quite stark. So we focus on just obesity first. Since we've been researching this through Britain's Healthiest Workplace, so since 2014, obesity rates have gone up 51%. What troubles me most about that statistic is that in the under 35-year-old group, they have the fastest rate of increase of obesity. Anxiety and depression is up 75%. I know with absolute certainty from the conversations I've been having at REBA this year already that this will probably not be a surprise to anybody. But sometimes when you have these statistics laid out, it kind of brings the weight of the situation and the urgency home. It turns what is your intuition into evidence. And as I mentioned at the top, this is of course a health issue, but it's not only a health issue, it's also an economic issue. I would say unsurprisingly, given all that I've talked about and the environment that exists and the kind of health state of the workforce, it isn't surprising that health insurance remains a highly in-demand benefit that employees are looking to employers to provide. But actually what I find really interesting and what is changing is that almost 1 in 2 employees now are turning to employers for mental health support. And that's going to be for a variety of reasons, as we are very much living in this post-COVID, highly complex world. Also, as we continue to see the stigma around mental health be eroded, which is great. It's a great news story. But it does mean that certainly that kind of mental health package and support for employees is shifting from being from being a nice to have to a need to have. If I can just reflect on some of the questions and some of the conversations I've been having this morning out on our stand, a number of individuals have come up and been talking about health, well-being and productivity. And one question that stuck with me was really, well, what difference can we actually make? Can we make a difference? Which is a fair challenge. And my answer is that it's unequivocally yes. And if we get it right, the impact we can have is both human and financial. So if I go back to some of the research that we've done at Vitality, we've found that, perhaps not surprisingly, the healthier a workforce, the more productive a workforce. Often it's said in a double negative. The more unhealthy the workforce, the greater the productivity loss, which is a bit bleak. But actually, there's a real good news story here. What we don't have to achieve is turning everyone into athletes to derive benefits. There's a direct relationship. And if we can help our employees become just a little bit healthier, small nudges, and just encourage them to take healthier steps, we actually start to see the productivity benefits as a result. Productivity, I know, can be quite an intangible concept, and it's very likely not going to be on anyone's P&L, but it very much is there. The £138 billion figure, which even if you think about the NHS budget, is still quite hard to grasp what that means. If we put it a different way, the impact of absenteeism and presenteeism and the economic loss of that to an organisation probably amounts to around 20% of your wage bill. Some people I've spoken to today, wage costs are absolutely the top expense item, and if it's not, it'll be one of your top expense items. And you'll probably be able to easily find out what 20% means to your organisations. If we can just shave 0.5% or 1% off that, the impact could be dramatic. So what does this now mean? What does this mean for organisations, for employers, and what does it mean for health insurers as well? So my challenge and my argument is that health insurers can no longer be your passive partner. They can't simply be there to pay for the hip operations, the cardiac angiograms. It's too late. The horse is bolted at this point. If we want to shift the dial, the power and the leverage comes at the bottom of this triangle, not at the top. So we've got two really powerful levers, and I'm going to describe some proof points around about what we can do. It's around prevention and early intervention. If we can prevent the claims from coming in the first place, the benefits are obvious. But sometimes our employees are going to need to claim. And if we can get in there early and get them in front of the right people, the right specialists, you still derive cost savings, better outcomes, and better experience. So I'm not arguing against excellence at the top of the pyramid, but what I'm arguing for is excellence throughout the pyramid. If we want to shift the dial, the leverage comes through prevention and early intervention, and the benefits are fiscal, experience, and outcomes. I'm a doctor, trained, went to medical school, worked in clinical practice for almost 10 years. And it won't surprise anyone that I was trained, what does good health look like? What does it look like when you become unhealthy? So pathology. And I was trained to treat disease as well. I was trained at med school a few years ago that prevention is better than cure. And I don't think that's a really controversial sort of position to take. So as a doctor, I can say prevention is better. But if we are going to invest the time and the energy at the bottom of the pyramid, at prevention, are you going to see any return on that investment of your time and your energy? I'm going to take you through some proof points to show that you will. So at Vitality, I mentioned we have our Vitality programme. And what this means is for our members who are on our health books, we help them take healthy steps through smart design, through behavioural science, and through really powerful incentivisation. So in just 1 year, we see our members undertake up to 22% more physical activity. Well, that's great. You're walking more, running more, whatever it might be. But what does it mean for them first? At REBA last year, REBA 2024, my colleague Katie Tryon presented some data that we just published with the London School of Economics, which showed that if our members undertake 10,000 steps 3 times a week, 10,000 steps 3 times a week, they have lower rates of diabetes and cancer, but not by a little bit. Cancer can be reduced by 19% and type 2 diabetes by 41%. So we can help people become healthier, build some good habits, and they have a direct health benefit. But it gets really interesting when we look at healthcare costs, because this is on everyone's mind right now. Through our Vitality programme, we have our most engaged members, and those are the ones who are just taking small steps, but on a regular weekly basis to be healthier. And if we look at our most engaged Vitality members, their health costs can be up to 28% lower, 28% lower. So yes, you've got the human benefit of making people healthier, and they're going to be happier as well. There's the cost benefit. And what this means for these individuals is there are shorter recovery times. They spend less time in hospital, or maybe no time in hospital. And of course, they need less time off work as a result. So yes, as a doctor, I can sort of say prevention is better than cure, but prevention just works. Prevention is that first powerful lever. I would encourage everyone to be thinking about how we can start to pull down on this. The second powerful lever, and the midpoint of the triangle, is early intervention. And one of the best proof points we have that is in mental health, which is great because mental health, 1 in 2 employees are turning to employers for mental health support. And so what have we found? Well, we were feeling this kind of pent-up demand. And so a number of years ago, we made a change and made it easier for our members to access really high quality mental health support through talking therapies. So that's going to be things like cognitive behaviour therapy and counselling. Unsurprisingly, we saw a steep increase in the claims for talking therapies. So we're meeting the demand, so that's great, meeting our customers' needs. We also saw a significant drop in the much more expensive in-hospital mental health claims. And what's not on this graph is an added cost benefit. And maybe over coffee we can talk about the mind-body connection. But of our members who claim for talking therapies, so the cognitive behaviour therapy, the counselling, yes, we have less inpatient mental health claims. We also have a 20% reduction in physical claims as well, which really does speak to, certainly when I was at medical school, mind and body were seen as 2 separate entities. We of course know that isn't the case anymore. So this is really an example of how we are moving very much beyond just treating the symptoms and treating the disease to changing the trajectories for our members. And we see exactly the same story when it comes to one of the highest volume claims around musculoskeletal medicine, musculoskeletal health. So by making it easier for our members to access really good quality physiotherapy care easily, yes, a 35% increase in claims, but a 31% decrease in, again, the much more expensive in-hospital claims. So I suppose what my message is really, this is not about doing more, it's not about throwing more initiatives against the wall and hoping something sticks, but it's actually just about doing sooner. health insurance very much used to be seen as the thing that's there for when things are going wrong. But actually with the right approach and the right mindset, I think my argument is that health insurance can be the reason that things start to go right. You are as aware as I am of the challenges that exist, but there are some clear opportunities as well. And the two levers that I think are most powerful now that are going to change the dial are going to be around prevention and early intervention. We have the opportunity to make savings from a cost perspective, a health outcomes perspective for our employees, and then a workforce perspective. Cool. Thank you. That's it. Let's take my drink.
We have plenty of time for questions, so if anybody would like to fire away and be the first person. I'm not sure if we've got anything on slide, though. That'll come up on the screen if we have. So if anybody wants to raise their hands and ask a question of Harpreet.
Oh, ready up here.
Hello. Oh,
Hi.
can you hear me?
Yes.
I just wanted to ask about the balance. So if you're getting more physio claims but less in hospital, does cost-wise, does that sort of balance out, or is there sort of a saving?
So we are seeing it balance out, and I think physio was up 35 and in hospital 31. I mean, the average cost of physio claims or even talking therapies is far, far, far lower than in hospital claims. So yeah, from a cost perspective, there are definitely sort of savings to be made by, and it makes sense. If we can intervene in a clinical journey earlier, you're going to get better outcomes. And that is for physiotherapy, mental health, cancer, cardiac care, everything. So yes, definitely.
Sorry. How would your offering here complement the NHS's offering?
Good question. So I think our offering is always seen as being complementary. What we have is we have the health insurance side, and we also have this behaviour change side. So what we are trying to do is if we can improve the health of our members, actually they are obviously going to benefit, the employees are going to benefit, and that's what I've talked about today. But also, if it's raising the health state of the nation as well, then it's benefiting society, right? So we call it our shared value model. So we are sharing the value and the benefits of everyone sort of becoming just that little bit healthier. So it means less demand. If somebody doesn't need to claim for a condition, it means they don't have to claim through us. They don't have to go and see their NHS GP and claim. So I suppose the benefits are broader and absolutely sort of complementary to preventing a claim in the first place, or when someone needs to see somebody, then of course we have, as I talked about the pyramid, we have the ability to intervene early and get people to the right place, and maybe have less barriers, less need to maybe always have to go and see a GP, for example, just to enter what can be a complex healthcare journey.
Thanks.
Questions?
I
I have one I'd like to ask myself, actually. I think it's really fascinating and really sort of brought to life the need for the preventative element. But what I'm more interested in is you talk about the idea of the concept of the programme. You've got lots of employers in there. To what extent are you seeing these conversations being had at the board level in those client organisations?
Increasingly, I think it's very much so. We are perhaps 5 years ago plus, there was much more conversations around, well, what more benefits can we just bring to our employees? And I think over the last few years, that conversation, for a variety of reasons, is changing to actually, we've got this suite of things they can tap into, but they're not always engaging in it. So how are we going to engage and find the meaningful things? And I think if we're engaging on someone's health, as individual as it is and as powerful as that is, then we are seeing at the board level, at the very top, people asking us about, well, and even today we had someone ask us, how do I get my staff healthier and keep them healthy? How do we get them to change and layer on those good habits? Because we know that you can form good habits in as little as 7 weeks. And then if you do, those good habits, they're more durable than the bad habits. So happening throughout. Absolutely.
I can see that we have a slide 8 question. Thank you very
Okay.
much for that. So if budget is limited, would you focus on prevention versus
Expensive.
how expensive insurance is?
Okay. Okay, I'll try and answer that. And if I don't, then please do follow up. So I think the power of prevention has historically been seen as this thing you've got to invest in now, and you only get the payoff in 5 or 10 years' time. But actually, what we are seeing is you can change behaviours now, and that behaviour change happens now, and you get the payoffs. You don't get the payoffs in 5 years, you get those payoffs straight away. And those payoffs are going to be through a happier workforce, they're going to be through a more productive workforce, they're going to be through a workforce that doesn't need to claim as much. So even with limited budgets, I would actually say if the strategy is there, and if the intent is we need to make our employees healthier and focus on prevention, as I think is probably the most powerful lever we've got, then actually healthcare costs go down, insurance costs go down.
Great, thank you. It's a very compelling argument there, I think. Any other questions? There's one.
On the preventative side and looking at something like PMI, where we're looking at mental health claims going up, and obviously individual therapies, talking therapies, has it been thought about along the lines of sort of like virtual sessions at the beginning of a day for all employees for something like meditation or breathwork?
Yeah, I think that's slightly anecdotal, not scientific. If you'd asked me personally about things like mindfulness probably 7, 8 years ago, I just wouldn't have even known how to engage with it. And not because of Vitality, but they've certainly made it easier. I think the power of meditation, of mindfulness, of convincing people the benefits and then making it easier to access is transformational. I personally do it now 3, 4 times a week just for 5 minutes, and it is transformative. So in answer to your question, yes, and I think there's different ways. So at the individual level, all of that can and sometimes is delivered virtually, but also at the group level. So with Vitality, we have, I'm going to do a bad job at explaining something, we have wellness calendars where we have these group sessions. It might be group sort of sessions around mindfulness or flexibility and yoga and these sorts of things, and bringing employees together, because some will want to do it by themselves. That probably reflects me. I've got colleagues who would definitely get more engagement and traction from doing it at a team or a departmental level. And with some of the organisations we work with, we'll have Vitality champions in the organisation. We have our Vitality coaches who are on our side, and they kind of go in and they do these. It could be virtual or even face-to-face at the whole company, depends on the size of the company, but it might be at an office level, or whatever it might be. And if we can just start to get people taking these small steps, then actually, as I said, it only takes 7 weeks from our research, and then healthy habits are actually formed, and they're really sticky then. So, yeah.
Any final questions?
Oh, I think there's one more.
Oh, yeah, thank you. So what's the answer to the topic of the talk? Can we afford to live without employee healthcare?
What's the answer to the top of the talk? Can I give just one answer? Yeah, I can. So I suppose if there is an appetite to shift the dial on employee health and well-being, that's if there's that there, then the way to do that is through prevention and early intervention. That is clear. Our data showing it. It makes sense to me with my sort of scientific hat on. That would be the answer. Can we afford to live without employee healthcare? I mean, to a degree, I would reflect that question back onto employers. I mean, I obviously will say, no, you can't. But I suppose what would be the impact to your organisation if there isn't a focus on health and well-being, and if there isn't a focus on employee healthcare? You may be the better audience. The audience may be better placed to answer that. What do you think the impact of AI in healthcare will do? Reduce medical costs, future possibility? I think AI is going to be absolutely transformative. It's going to be transformative. We're seeing it already in medicine, perhaps a little bit more, as we could kind of call it, back office and being a support tool. We're seeing it particularly in areas like radiology, so making it easier to quickly report on scans. But there's still a lot of human involvement to make sure, as we're testing the accuracy and validity of the models. But I can see AI being a massive support tool and making it easier. It's going to kind of really shorten these kind of long, clunky healthcare journeys. So will it reduce costs in the future? I suspect it probably will. I think we'll see it in areas of radiology and probably dermatology first. But I think what is going to be really powerful is going into the huge amounts of healthcare data that we have, particularly the NHS has, and helping to find those individuals, those patients who've just got these little risk factors, these little areas that if we find them now and intervene now, we can put them on the right course with the right program so that you either prevent illness or delay it. And if we can do that to the big things, obesity, cancer, diabetes, cardiovascular disease, I mean, it could be absolutely transformative. I think we're a little way off that scaling, but it's definitely on the horizon.
Well, Harpreet, thank you so much. That was fascinating. A
Pleasure.
bit of a call to arms, I think, for
Hope so.
some of us in the room at least. Thank you very much for your questions as well. And just like to put our hands together and say thank you to Harpreet.
Pleasure.